diagram. I think mainly because we didn't really want to draw any more pictures. We decided from the last task we weren't particularly good at it. So we thought if we put it in a diagram, it would be something that both looked good and we could explain it very easily. I'll just go through sort of how we got here, really. We sort of started off with the triangle because we thought we were building on what we had on one of the other pictures of sort of how policy is driven in different healthcare systems. And what we thought was often it's the job of very few people to dictate policy that goes to the masses at the bottom. So that was what the sort of symbolism. And what we were going to do was that we were going to stick with that. I'm going to have some grading systems here, and then flip it round so that it would be the ideal sort of the ideal situation would be that you had the patient focus, which are usually at the bottom, being at the top, and then that dictating policy as it goes down, which I think is a really good idea anyway. But we expanded on that, and we were posing as many questions as possible to each other. And what we came up with are sort of the 3 points that should dictate policy and healthcare management, which you've got in the bottom, because they should be focused for each area. So we had the patients. We decided to put these at the top of the triangle because we think, as I just alluded to before, they should be the most important area to focus on, certainly. And then you've got the government and the providers, which are obviously the policymakers and the implementators. So you've got both sides there. And we decided that effective healthcare management would come in somewhere in the middle. Because the idea is you've got to bridge the gap between these 3 points of the triangle. So what we decided to do, so put them in the middle as a circle, and then have some nice arrows to signify that you've got to bridge the gap between all of them. And I believe that's it. But what this should effectively sort of culminate in, if this sort of process is done correctly, is a effective, patient-focused healthcare delivery system, signified by the patient in the middle there. Any questions?